Good morning, everyone. Today, I just want to do some recordings for this topic, which is the management of fear and anxiety in the dental clinic. This is very important topic because most of the patient will come with the anxiety, and mainly it is related to the dental settings, right? So sometimes they say that I don't like someone working in my mouth, and sometimes they do not like the noises. So it is very common that we encounter these patients. So it it is very important that you need to know how to deal with the anxious patient, because when we work in Australia, so there are many patients who comes with the complaint that we are very anxious, and how you can deal with those patients, and what management strategies do you have. So we will read in detail through this topic, okay? So first of all, you need to do maintain their anxiety, and there are different types of these fears, okay? So they divided this fear into like the fear, anxiety, phobia, and sometimes the pain. Okay, so fear and anxiety are interchangeably used, and there is not very variation. Phobia is just like superior forms of anxiety. The people who cannot just really enter the dental setting, and they cannot just let you touch their mouth or something. They are like extreme patient. And pain, so it is really expected the patient to have this much amount of pain because of the condition that they are having. Or sometimes it has been seen, according to the researchers, that the female patient are more likely to show their pain as compared to the male patient. So this is just the introduction about all these things, but it is not very important for our management. Okay, so then typology of it is also not really important. It's just that you need to know what individuals who are fearful to the specific stimuli, you need to know during their history, that is there anything in the dental setting that can increase their anxiety. Because some kids, they might be having any sensitive related issues, so the lighting in the dental setting, that is very strong, right? So we need to give them the sunnies. And the other thing, the noises, so we can try something, some good music or cartoons for them. So there are certain strategies. Okay, so firstly, you need to identify and you need to assess those patients. To work successfully with a fearful dental patient, a dental practitioner must first identify that an individual is scared or nervous, and then adopt an appropriate treatment approach tailored to that patient's concern. Because we cannot use like the general strategies for every patient. Every individual is different, so we may need to modify our management according to that patient. Indeed, most dental practitioners will attempt to elicit information from their patients about possible dental concerns, but the approach can be highly variable between patient from one patient to between dentist and from one patient to the next one. So here you just need to inquire about their anxiety, and there are some like the scales. Like what one scale is the modified dental anxiety scale. It contains 5 items and is reliable and quick to administer. So you can measure your patient, like how much fearful they are. Or the another scale is index of dental anxiety and fear. It contains 8 item module measuring the physiological, cognitive, emotional, and behavioral components of the dental fear, and additional 10 item stimulus module. And so these are just a scale that you can measure your patient, or you can just give them like on the scale of 1 to 10 how fearful you are, so that you can modify your treatment accordingly. um Then the other thing is, this is the most important thing, which is the enhancing trust and control. If you want to deal with the anxious patient, you need to build the trust and control, because these, if once you get these patients settled down in your surgery, they are happy with you, you know, those patients are for life. They won't go anywhere else. They are for you. So they have conducted interviews with dentally fearful individuals who were able to seek regular dental care. And when they were asked what skills they used to be able to complete treatment, two of the four key terms were trust-filled interaction with the staff and striving for control. So you need to make sure that your patient understand that everything is under their control. If they want us to stop at any time of the appointment, we will stop. It is very important. And building trust in the staff included communicating and cooperating with the members of the dental team. Developing a sense of control, meanwhile, involved taking an active role in one's own care and communicating one's wishes to the dentist and staff. So they can say that, you can just count for 1 to 5, and after 5, you need to give me some rest or break, or I will lift my left hand up, and at that time, you need to stop. So these are some of the things that you both need to understand, and you need to modify your treatment according to the patient need. Then rapport and communication. So your communication does play a very major role here, because the dentist friendliness and providing patient with moral support were important factors in patient satisfaction with the care. So you need not to make the patient, uneasy in your appointment. You need to make sure that you say, it is very normal to see the dental fear or anxiety in the dental setting. It is very normal, and we will work around you, and we will make sure that you are comfortable before we start to do any procedure on you. And everything is under your control. You can stop us as many times as you want. Okay, then the communication between the dental practitioner and the patient is crucial for providing working relationship that results in competent clinical care. So they have found that the communication with their dentist had better outcome related to satisfaction and lower fear than those who felt less positively about their dentist community. So your communication skills also plays a very important role, and sometimes the non-verbal cues, effective listenings. So essential elements of the good communication would involve establishing an effective two-way interaction. You are not the only person that you just give throw your knowledge to the patient. You also need to listen and emphasize what the patient really likes to hear from you, and genuinely acknowledging rather than dismissing. You, if patient asks you something, you cannot say, okay, I'll come to that later. You need to acknowledge that point with him, and you also need to address the patient's concern, attending to non-verbal clues. So even if your patient is, looking here and there, and he's not actively listening to you, then also you need to ask him what is actually happening. Is he fearful of the appointment? What's going on in his mind? Effective listening. If your patient is saying something, do not cut him in the middle. You need to listen him actively, and you need to accurately reflection of what the patient says, demonstrate empathy, and using appropriate voice and tone. Okay, so these are very important elements that you need to focus in good communication skills. Related to the development of good communication is what has been called the iatro sedative technique. So it means sometimes with the voice and with the way you talk to your patient, the patient get convinced, and they are very cooperative patient later on. Okay, so this approach is aimed to make the patient calm at the dental practitioners by the dental practitioner's behavior, attitude, and communication stance. More simply, Sedation is a process of communication between the dental practitioner and the patient that creates a bond of understanding, trust, and confidence. Ultimately, rapport, communication, and trust form the backbone of any anxiety management approach. So, it is very important that you create a rapport with your patient, with your communication, so that will help you in building trust and confidence and support. Then information. So it is very important that you let your patient know what's actually happening inside his mouth and what is your treatment plan, how you will proceed, what you need to do, any investigations, any x-rays or any examination. You need to explain to the patient first and then you will do. So it is also in short a tell, show, do technique. Okay, so you need to provide the patient with the information about the procedure and can help correct misconceptions patients may have about treatment, such as what sensation can be expected. So even if you are drilling in the patient's tooth, so you will explain to him like there will be a lot of water and sound. Okay, so the patient can expect like what is going to happen. And you also need to tell him the length of treatment, like it will take 10 minutes for me to drill the hole and then we will clean it, then we'll put the tooth shampoo, that is the etching, and we'll clean it again and then we'll put the filling. Okay, so such information is also helpful in increasing a sense of predictability during the procedure, so they would know what you are actually doing, so that can help reducing the fear of unknown. The usefulness of providing information often relies on the type of information given. So it is very important what information that you are providing, what time you are providing, and what's patient's preference, because sometimes some patient wants to know all the information at the front, but some people likes to go like play by play, like they want to whatever you are doing each step they want to know like what you are going to do next. Okay, so sensory information tells patient what they can expect to feel like when you are doing the extraction. So after you have numbed the patient, you would explain that you would feel pressure, but there should not be any pain. If you feel pain, then tell me and I'll give you more numbing solution. Vibration. So if you are using slow speed handpiece, because you all know that is bit bumpier and the patient would feel the vibration, so you need to tell your patient what sensory sensation would they feel. Tell patients the order in which part of the procedure will happen. Like first you will administer the LA, then followed by placement of the rubber dam, and then you will use the handpiece. So you need to describe everything, every step, what you are going to do. Some patients prefer to know about the procedure generally at the start of the appointment, but some like to know play by play, like at each step. And dentists are well served by asking patients prior to the start of the procedure what type of information they would prefer and when, so that the correct amount of information is provided at the appropriate time. So you need to ask your patient what are their expectations and what they want us to do, like play by play or every information at the start. So providing control. First step is the tell, show, do. It is very important technique and it is very helpful in combating the stress level. Okay, so this involves an explanation of what is about to happen and what instrument will be used and the reason for this. So this you will tell the patient, followed by a demonstration which would be the show phase. Okay, and then you will do phase is then the initiated by carrying out the procedure. So, despite its popularity and its widespread acceptance in several countries around the world, the Telsho-2 technique has not received very much research into its effectiveness. So, one study was conducted in, okay, so Telsho-2 has been shown to be efficacious in reducing anticipatory anxiety in new child patient, although it is less useful for children with previous dental experiences. Okay, then although the tell show do technique was originally developed for use with children, but now it can also be used for anxious adult, where it can foster a sense of both control and predictability. So in adults, generally it's explain, ask, show, do. So first you will explain the patient, and then you will ask him if you have any doubt or you want me to explain anything again. Then you will show what you are going to do, and then you will do for them. Okay, so it is very important technique, and this process attempts to balance the fears and phobias of the patient against the desire to make progress, while simultaneously respecting where the patient is currently at, both physically and emotionally. Then you also need to give your patient rest break. What is the rest break? It means that like you need to tell them, like, I will, like, mainly for the children, you will tell them like, I will count to 5 and then I'll stop, I'll give you a rest. Okay, so after counting to the 5, it is very important that you give them a rest, because otherwise it can break the trust. And for the adult, you can also ask them to raise their left hand whenever they want us to stop. Okay, so they can't bear it any longer. So at which time it is more difficult for patient to calm themselves down enough to continue with the procedure. So it is very important that you give them the rest break, and it able to pause the procedure and can increase the patient's sense of control over treatment. They would feel that everything is under their control. Dental practitioners should be sure to communicate to their patient at the start of the appointment that the patient, are able to indicate that they will need a break, like by lifting their hand up. Dentist-initiated rest breaks are particularly helpful when treating patients who are not assertive or want to push through an appointment as quickly as possible. Some patients do not wish to request a rest break for fear of appearing to be a difficult patient. So some people, just for the sake of being a good patient, they do not show you, but you should know, like, after some time you should give them a break. Dental practitioner can plan the rest break in advance, such as telling the patient they will work for 5 minutes and then they will take a 1 minute break. This increases the patient's sense of predictability and control over the procedure, as they would know that they can watch the clock and anticipate the upcoming break. So it is very important to give them the rest and the break. Then signaling. So signaling would be raising their hand up. So it is very important that you tell your patient how to signal you to stop treatment. Is a key component of building communication and trust between the patient and the dental practitioner. So many dentally fearful individuals, they recall experiences in which they felt their dentist did not know they wanted to stop treatment. Like they were feeling pain, but they could not show the pain because they were in the middle of the procedure. So you a signal can be as simple as a raised hand to notify the dental practitioner that the patient would like to stop the procedure. Specific signals can be determined ahead of time. Before starting the procedure, you should tell your patient what signals that they can give to you. First is raised hand means stop, while a raised index finger may ask the assistant to use suction device. Okay, Singh and colleague provided patient with an electronic communication system that allowed patient undergoing endodontic therapy to communicate that they were feeling pain. So there are certain electronic ways that they have used, because the endo treatment, it is a long procedure, and there would be rubber dams, so patient can't really communicate with you. So it is very important that you give them the signaling before starting the procedure. What are the other psychological approaches? First is the distraction would be either the music, auditory stimuli, or visual, like either the TV in the dental setting or the music. You can give them the headphones with the music. So it is very important, and it is helpful for some patient to reduce their. So there are some clinical trials, and they found out that the music therapy reduces pain and anxiety for children undergoing medical and dental procedures. Okay, so these are some of the other ways. We do not need to go in much detail, but we should know what are the other statistics we do have. Okay, and the other thing is the positive reinforcement. It means that like in between the patient, you need to say like you are doing really well, good job, like you're going well. You need to reinforce the positive things to them. This is very important to the children, but it is also important for the adults as well. So it can give them the motivation to go on with the treatment. In relation to the children, it is believed that it is not possible to have too much reinforcement, although the clinician should attempt to be genuine in their offering. Okay, so many dental practitioners are encouraged to use positive reinforcement to obtain cooperation with dental procedure. However, the effect of positive reinforcement in relation to dental care behavior or behaviors when visiting a dentist has received little significance. Okay, and positive verbal reinforcement and a brief period of escape are rewarded for the patient lying still and being quiet. You can give them some rest and give them as a reward, like you were doing really good while the procedure, so I'll give you some break and keeping well and all those things, so that can enhance their motivation. Then diaphragmatic or relaxation breathing. So this is just an exercise. The physiological changes accompanying relaxation breathing or diaphragmatic breathing effectively form a counterpart to and are therefore incompatible with the emergence of fight or flight reaction characterized. So if the patient is really anxious, you can ask them to take a deep breathing, so they can this breathing can help them release some of the anxiousness. Then progressive muscle relaxation. So it is a systemic technique initially developed several decades ago and subsequently standardized for the use by the therapist and the researcher. So the procedure has been widely used and successful to manage the anxiety. In addition, it has been shown to be effective in treating the patient with the, for example, in comparison to a cognitive therapy, progressive muscle relaxation has been found to be result in a more reduction in dental. So it is basically based on the principle of muscle physiology, what that when a muscle is tense, releasing the tension then causes relaxation of the muscle. Okay, so further so like when you are doing the treatment, like for example extraction, and patient has opened his mouth for quite a long time, so his TMJ muscle can get worse and sore, so you can give them some rest that can help with the jaw muscles. Okay, and then the guided imaginary. You can, sometimes we can ask the patient, think about like you will be out of pain after this appointment, or think about that you are on a beach and lying and relaxing, watching TV. So just it is just a guided imaginary. You can just sedate them or guide their imaginary to be to so that they would think of something positive rather than getting anxious. Then cognitive restructuring. So while distraction and guided imaginary aim to shift a patient's attention away from the fear-evoking situation, cognitive restructuring aims instead to alter and restructure the content. So it means that you need to, you can also try this technique. It means that you need to motivate your patient that you can do this, you are stronger than this, or you can, these techniques like the guided imaginary or the distraction are pushing the patient away from this situation. So you are guiding the patient thoughts that he would think of something else rather than disappointment. But a cognitive restructuring means that you are asking your patient to think about this patient and deal with his fear, that he's strong and he can do this, he's so all those things. And then systemic desensitization. It involves gradually exposing a fearful individual to the aspect of this dentistry they find frightening while encouraging them to use relaxation strategy. For example, for a patient who is fearful of injection, the dental practitioner may first show him or her the syringe and explain its parts and purpose, until the patient is able to view and hold the syringe with little to no anxiety. And next, the dental practitioner may place the syringe with the needle capped in the patient's mouth to stimulate the injection. So you just need to expose your patient slide by slide, you cannot give them directly a needle. So you need to take a smaller step to imbibe their anxiety. Then the hypnosis. So it is has been defined as an interactive process whereby a hypnotist attempts to influence a person's perceptions, feeling, thinking, and behavior by asking them to concentrate on ideas and images in order to evoke. So hypnosis, we all know. So it is just like you are now relaxing, deep breaths from your nose, you can do this, all these strategies. So this is just to help with the patient fear. Clinical practice. So you just need to know the name of these techniques that you have, and you should understand what the all technique is. You do not need to go in much depth, okay, but you should know what methods do you have. Clinical practice and treatment approaches for managing dental anxiety. First of all, the what could be the clinical practices? Your environment. So it is very important that your environment should be good. So indeed, studies have found that changing aspects of clinic environment, including how the appearance is, the order, can have effect on the perceived anxiety. For example, there was a study done in UK, and they found out that dental patient exposed to a lavender scent while waiting for a scheduled appointment exhibit lower state of anxiety than did control patient. So you also need to focus on your dental setting, that it can also help in relieving the anxiety. So a study of dentally anxious student found a stated preference for offices with adorned rather than bare walls. So there should be something, and for a slightly cooler temperature. So in a more extensive environment, changes involving a partially dimmed room with lighting effect, vibroacoustic stimuli, and consistent body pressure. So these are some of the strategies that you can use in your surgery to to deal with the patient, um, anxiety. So the alternative methods of tooth preparation, we all know the atraumatic restorative treatment, in which we do not really use any burrs or hand pieces. We just try to go as conservative and as possible. Air abrasion, infrared laser, so they are some of the techniques that can be used for painful or uncomfortable aspects of dentistry. Therefore they can help in reducing anxiety and fear of the patient. And what for people who feel anxiety in relation to the noise, vibration, discomfort, or pain, for a standard like from the drill or air abrasion offers another worthwhile alternative. So you just need to ask your patient what actually in the dental setting that they are feared about, and you can try some other strategies to deal with that fear. Then treatment planning, how you need to make the treatment plan for this patient. It is strongly recommended that treatment planning for highly anxious people be both flexible and introduced to the patient in phases. The important element here is not to overwhelm anxious individual who may already be catastrophizing about the dental visit, including the extent of dental treatment. So you should not give him all the knowledge in the one appointment. He will be very anxious and he would be like, my anxiety has not relieved after this appointment. It has increased. So you should take stepwise method. And phasing treatment also allows time for the patient to learn and practice some of the behavioral strategies suggested in this article. So they can use any of these techniques they help that can help them, and just make the treatment plan and be more flexible with them, because it should be because they are also dealing with their fear. So that is very important thing. You should also be more calm and cooperative with them. And then scheduling appointments. It is generally recommended that fearful individuals schedule appointment for a time when they are not rushed or stressed. Okay, so early in the morning is often a good time, because it is because you should not stress them or push them to be in hurry. You should give them their time to deal with the anxiety. So that's the reason they mentioned that the morning appointment are a bit better for them. Then management of dental fear and anxiety in children. Much of the preceding discussion, like whatever we have you discussed before, we can use same things for the children, like tell, show, do. Then the distraction by TV or playing cartoons or music. Okay, or the other technique is the modeling, in which we can ask them to, the elder brother or sister to do the dental treatment first, so the younger one will get the idea how to behave, and they would just like, it is just a modeling technique. Or we can also show them some videos of cooperative children and what to expect, and they would try to do the modeling of that. Then the distraction would be the same thing, that is the TV in the room or the toys in the waiting room, that can also help them with the anxiety. And you can also give them some stickers at the end of the appointment, so they would come, and they would come in the next appointment with the that they want some stickers, and they'll get from stickers from the dentist. So just give them some distractions. And cognitive restructuring means that you need to prepare your patient for the next visit. So for example, you will just tell them, if you are planning to place the whole crown, you can tell them, for the now we have put the donuts in between your teeth, that would help in creating some space. And in the next appointment, we will remove these donuts, and we will put the the cap on your teeth or helmet on your teeth that would protect your teeth. So you can structure them accordingly. Then restraint, so this is very last source. There are several behavior management techniques which involve the forced restrictions of a child movement, also somewhat emphatically called a protective stabilization. So these are there are some techniques, these techniques we generally do for very uncooperative kid. And even if we have done all the other strategies and still the patient is not cooperating, and for sure after the consent of the patient's parent, so we will use these techniques. There is something called as Pepu's board method, and physical restraints such as the hand over mouth exercising or holding the chest down by the dental practitioner or the parent. but this is just their last resort. We cannot, use them, because if you will use that in today's appointment, it would bring a very bad memories in their thoughts, and they would never come back to you. So that is the thing. And the other thing is the voice control. Sometimes it is a punishment technique involving a controlled alteration of the voice volume, tone, or pace, which more specifically equates to issuing combats. So these techniques are generally for the very uncooperative kids who are not at all listening to you. You can try something called voice control, where you can use your like increase your voice tone, volume or pace to like help them to controlling them. Okay, and there are so this is just, we are done with all the techniques. So from this article, it is very important that you understand how to deal with this patient, what treatment plan you need to make for them, how flexible you should be. You should make them a morning appointments, what strategies you have either for the adults or for the kids. Okay, and along with this, there is one Odell chapter for the uncooperative kid, and in Cameron also there are some strategies given like non-pharmacological methods. And for the pharmacological methods of the anxiety, we already did this topic in from TG, which is that you can use some nitrous gas on them. For the kids and for the adult, you can even use some benzodiazepine 1 hour before the procedure. Hopefully, this topic would help you in your exam. And thank you so much for watching my video.